word for high BP. Okay, hyper is high, tension is tension within your arteries and veins. So high blood pressure, also called as hypertension, is blood pressure that is higher than normal. Okay, so when you have high BP, you have higher blood pressure inside your arteries and inside your veins. What are the signs and symptoms? See, there are many, like, so the signs mentioned here might not necessarily be all the signs someone experiences when they have high BP. Someone could just have one of these. This low should have been like high, but basically, see, people experience when the BP goes high, they start experiencing dizziness, they start experiencing palpitations or irregular heartbeat, they start experiencing nausea, they start experiencing vomiting also sometimes. Sometimes with extremely high BP, people actually have a fainting response. Mood-wise, when your BP is high, you will experience more irritation and anger. You'll generally be a little more crankier because your body is in the state of hyper, like just too much pressure internally. And if you measure on your machine, right, like you measure, you'll actually see it. So low is wrong here, but you'll actually see that your BP is higher than its normal ranges. So these are some of the signs and symptoms. See, what really happens when it comes to high BP, we have to understand that as an evolutionary response, right? It's an evolutionary response that the body naturally has. When we were threatened, like even our ancestors, the hunter-gatherer forefathers, every time we get threatened, we activate a certain nervous system called as the sympathetic nervous system. So this actually is supposed to take care of your survival. Your survival includes running away or fighting with that threat or just moving away from that threat. For you to be able to do that, you need more blood flowing in your limbs and all your peripheral organs. To enable that extra blood flow and to enable that kind of action orientation, your body will increase blood pressure. Okay, so there are very, very beautiful mechanics in play why blood pressure goes up. It's a natural mechanism of the body. However, when we speak of it as a disease or a dysfunction, we are speaking of conditions where this is the normal thing, right? So your BP is on the higher end all the time. So that is something that definitely is not going to be okay for your body because it's going to cause more harm in the long run. Okay. What are the types of hypertension? One is primary hypertension. So you like this is like your BP is just high, but it's not related to any other medical condition, right? So there is no other medical condition happening in your body. It's just that your BP has gone up. Secondary kind of hypertension is because of some other medical issue, usually when the kidneys are dysfunctional or when the arteries are clogged or when the heart is not working well or the endocrine system, the system that makes your hormones, if that is not functioning well, that triggers increased blood pressure. So for example, even if you have sleep apnea, right, like you can't sleep well or you're not breathing enough during sleep, you're having broken interrupted sleep, that will cause increased blood pressure because that kind of sleep is a sleep that your body recognizes as a threat. Like this is not normal, this is not relaxation, this is not safety. So in that lack of safety, your body actually starts reacting as if it would react in a survival mechanism, and that can cause increased blood pressure. Blocked renal arteries in the kidney. So these are not all, these are just some examples, right? So if your arteries in the kidneys are blocked, it can increase your blood pressure. Kidneys have a huge role to play in regulating blood pressure. If you have very high levels of cortisol, if you have very, very high levels of other adrenal hormones, like adrenaline example, right? This can actually impact your blood pressure, and these unusual levels of hormones can increase your blood pressure also, right? So primary is when your blood pressure has gone up without any of the other underlying conditions. Secondary is when there are some other underlying medical conditions, and because of that, your BP has gone up. So it's like when I say it doesn't have a single, it happens on its own. That's because someone can't identify what is the single root cause of why someone's BP is elevated, right? So that's when it gets called as primary. Like if it was or your kidneys are impacted, that's why your BP is high, that becomes secondary hypertension. But if there are like just no distinct reasons why the BP should be high, but BP is still high, then it's called as idiopathic or essential hypertension. And how do you know you have high BP is when your blood pressure is above 120/80. What this means is you have your arteries through which your blood is flowing, right? Like this is a pipe, and through the pipe, blood is flowing. When it's going through your arteries, it's actually carrying all the nutrients to your organs. When it's coming through your veins, it's bringing back blood to the heart and lungs for it to get filled again with nutrients and oxygen. So either ways, like in your arteries, when your blood is flowing, if it's flowing with a lot of pressure inside, it's going to be pushing on the arteries, right? So that extra pressure is something that is called as high BP, and too much of pressure on the arteries is going to damage the arteries, and that kind of pressure overall in your body is going to damage a lot of the other organs, because we are not supposed to be living under that pressure. We're supposed to have a smooth flow of blood through our system. Okay, so what causes essential primary hypertension? So there are many reasons that could put you at risk. For example, we've seen in our work that even genetics can impact your BP. Okay, so even small mutations in your genetics, are, especially with your ACE2 receptor genes, if you have those kind of mutations, what will happen is you're prime for high BP. So someone with those kind of genetics having really bad lifestyle, like long term, like drinking and then smoking and then not sleeping enough, actually will show up with high BP, versus another person who does not have those genetic flaws but doing the same lifestyle might not show up with high BP. Then the other reason we've seen is, and also proven by a lot of studies, is insulin resistance, right? So insulin again is a regulatory hormone. Along with blood glucose, it actually works on a lot of other organ systems. So if you have insulin resistance where your cells are not opening up to insulin, even that insulin resistance can trigger high BP. Third is if you have salt intolerance. Now, what do we mean by salt intolerance? See, salt is essential, okay? Like salt is a very, very important mineral for us. And in fact, most of us don't have enough salt in our day. But genetically, you might have issues with salt, like sodium chloride processing, or, maybe you're not drinking enough water and like you're chronically dehydrated. In such cases, then excess salt can also cause your BP to rise up, though I wouldn't really cause salt, like it's not the primary reason, it's just as like other lifestyle issues that impact it. Obesity, again, excess body weight will force your heart to work harder to push blood to all of the organs and the peripheral system. So even your hands and feet and toe. And every time you have excess weight, your heart has to work harder to push that much blood out, right? So obesity on its own can contribute to primary hypertension, but generally a mix of all of these things together definitely causes hypertension. Long-term alcohol consumption. Alcohol is something that should not be going into human bodies, okay? Like it damages the liver, it damages the brain, it has way too many bad effects, including depleting your B complex nutrients. But even if you're somebody who has an occasional drink, that might not cause high BP, but if you're regularly consuming alcohol, that could trigger BP issues. And then disturb circadian rhythm, like I spoke earlier. If you're someone whose sleep quality is very, very poor, see, sleep is the time when our bodies restore and relax and rejuvenate, okay? That is like primary for you to be able to function every day. Now, if you're not getting good quality sleep, your body, your brain, everything is sensing that, oh, sleep is compromised. So probably not safe, and like I need to be hyper vigilant, and just that lack of sleep, like it just disturbs the entire processing, right? The detoxification pathways, the rest that the liver is supposed to get, everything gets disturbed, and that can trigger high BP. We've seen this, like it's such a common root cause for high BP, and people don't even know that their sleep habits are increasing their blood pressure. Like I mentioned earlier, secondary hypertension is high blood pressure caused by another condition or disease. So kidney disease, thyroid problems, adrenal disease, and obstructive sleep apnea, all of them could trigger secondary hypertension. So for example, right, like if your kidney gets injured, or if the arteries of your kidney are too not narrow, or if there is like a failure in the mechanics of your kidney, this can trigger higher production of a hormone called renin. And renin leads to production of substances like angiotensin 2, which can raise the blood pressure. And therefore, because your kidney is not working well, your BP can go up. And you know, this is such a vicious cycle. Like we've seen people being given BP medicines without finding out the root cause, right? Like doctors usually prescribe BP medicines every time they see someone's BP is higher beyond 120 and 80. Now, there's a possibility that because your kidney is dysfunctional, your BP has gone up. Most of the BP medicines are actually diuretic in nature, which means they actually reduce your blood volume by making you like just urinate more. When you're urinating more, there is more work for the kidneys to do. So while you're taking a medicine that is temporarily lowering your BP, it's actually making your kidney function worse. And then that becomes a vicious cycle, which continues to raise your high BP. Okay. Along with those physiological issues, there are also medications that can contribute to secondary hypertension. So birth control pills can do that. Non-steroidal anti-inflammatory drugs can do that. Diet pills. A lot of people take these fat burners, right? And because we are in the world of nutrition and we work with so many people who come to us for weight loss, I've heard all sorts of things from people, right? Like including taking fat burners and those metabolic injections and all of that. Those can also increase BP. Stimulants like even tea and coffee. If you're someone who has high BP, tea, coffee can actually trigger increase in your blood pressure. Antidepressants can do that. Immune system depressants can do that, and decongestant. So, you know, if you're taking anything to kind of, if you have a lot of mucus, if your nose is blocked, and you're taking all of these cough syrups, bronchodilators, decongestants, they can also cause your BP to go up. So adrenal disease located on top of the kidneys. I know this is getting a little technical, but see, the thing is, if you don't really know the true reason of why BP can go up, it could become a real problem because you could just be treating the symptom and not the root cause. So you have to understand a little bit of the technicality of why your health goes away, right? So the secondary hypertension can also be caused by adrenal diseases. So these adrenals are these two glands that sit on top of our kidneys, and they produce and regulate a lot of hormones, including that adrenaline, right? Like the rush that you get when you're doing something, roller coaster rides, even when you get into a fight and how your body just feels all heated up, that's usually adrenaline's work. When there is a problem with your adrenal glands, the hormones, like the hormones that the adrenals make, they can become more in the body and they can cause issues with your blood pressure itself. The other one that we've commonly seen is hyperparathyroidism. So your parathyroid glands are glands that are situated just behind your thyroid, right here in the neck area. And these glands actually are involved in regulating calcium levels in the blood. But if these glands actually start producing extra hormones, like it's a hormone called as PTH, so if they start producing too much parathyroid hormone, that then will lead to high blood pressure. Okay. Even a thyroid that is not functioning well can lead to high blood pressure. So you understand, right? Like you just get a diagnosis of high BP and you get medication, but there are so many root causes that could be triggering it. And the good thing about discussing all of these root causes is, if we can identify a root cause, we can identify a solution for it. Okay, that's like something that iThrive is really good at. We work with nearly 158 plus different diseases. We use a lot of tests, like from basic tests that you can do in India to advanced tests that we send samples to the US, because our focus is always on finding the root cause, because this we know and we've seen in the last 4 years of our work. If we can find the root cause, we can create a solution for it, right? So even if you or someone you love is suffering with high BP and they're already on medication, find what is triggering it. The minute we find out what is triggering it, we can help reverse it. Okay. Incidence in India, 25% of urban population, 10% of rural population suffers from high BP. 70% of all high BP patients are stage 1 hypertension, and 12% of all high BP patients suffer from isolated systolic hypertension, which means just that upper number is high and the lower number is within the range. So this is what, see, why do we do these webinar series? Because we want to talk to people about dysfunctions. We want to talk to people about how easy it's to reverse them. But we also want to talk to people about what happens if you don't work on your health. So you might just think, oh, it's just high BP and I take a medicine and it seems fine. Only on the days I don't take the medicine, my BP goes up again. If you don't get to the root cause and if you don't treat this from the root, what is going to happen is that high BP can lead to any of the complications listed here, right? So stroke, heart attacks, okay? Because see, the heart is a muscle in the end. Anyone who has done weight training, any of us who work out in gyms know that we go to the gym only for 1 hour. We don't push ourselves for 24 hours to push weights. Similarly, the heart is supposed to function at its normal heart rate. If it's working hard for a brief period, okay, you had some stress and then you needed to pump extra blood everywhere, and then you got time for rest and recovery, that is okay. But throughout the day, if it is beating really hard just so that it can pump blood and because the pressure needs to be maintained, that can cause weakening of the cardiac muscle itself and lead to a failure of the heart. Peripheral vascular disease. So vascular is basically anything to do with your veins and your blood vessels itself. So because your body is pumping blood at such high pressure through all your blood vessels all of the time, that can start degeneration of the veins, especially in the periphery. Like periphery means further away from the center of your body. And it can lead to peripheral vascular disease. Kidney disease, kidney failure, I already covered the kidney, but kidney is a very important organ when it comes to maintaining blood pressure. And if for some other reason BP has gone up and that pressure is coming on the kidney to kind of continuously reduce blood volume and help manage the pressure, it will lead to failure, okay? High BP has caused, like this we know, there is a condition called as preeclampsia, quite fatal if not managed well. Can be a huge risk to the baby. The unborn child also is a risk to the mother also. During delivery, it can actually be a fatal issue for a lot of mothers if their BP is not controlled during pregnancy. High BP can also lead to eye damage because see, your eyes actually have a lot of nutrients that come, lots of blood vessels are there, right? If you remember, like when you rub your eye also, how immediately it becomes red and you see all these small capillaries. It's a very delicate tissue. Now, if your blood is pumping at a very high pressure all the time, that same pressure is going to be felt even in the fine capillaries of your eyes. And over time, that kind of pressure, because the eye has pressure from inside also, the fluid that is there. So that extra pressure will start degenerating the eyes. Vascular dementia. Dementia is basically loss of your cognitive function, right? Dementia, loss of your mental capacity. You could lose your cognitive function or your mental capacity because there is too much of pressure that's coming in and through the capillaries, veins, arteries, everything that are running through the brain. And brain degeneration, overall brain degeneration, again, because of that excess pressure that's there inside it. So understand one thing, we are not meant to be like pressure cookers, right? We are not supposed to be living with pressure inside our bodies. And high BP exactly does that. High BP actually makes you into a walking pressure cooker. And we have to let the steam out. We have to remove that pressure and bring homeostasis or balance inside the body. Okay. Predisposing factors, advancing age, of course, because even if you have genetic flaws, they're going to get more evident with age. Family history of cardiovascular disease, sedentary lifestyle, and psychosocial stress. Stress is a big, like stress. See, ancestrally, stress was from tigers and lions that would try to eat our ancestors. In today's time, stress comes from just about everything. You're stressed for time, you're stressed for money, you're stressed with relationships, work, you can't say no to stuff, so you take on more than you can deliver. You have resentment building on. Maybe you don't have really great boundaries in your personal life, and that is kind of just overwhelming you. So people are living in this perpetual zone of stress, and that zone of stress can then lead to high BP if it's not got enough ways to release and let go of. Obesity and weight gain, I kind of covered that. Low fruit consumption from the perspective of not getting enough antioxidants in your diet. So fruits are rich in antioxidants. If you have a lot of oxidative stress because of other lifestyle factors, or again because of genetics, then that oxidative stress is again going to trigger inflammation. That inflammation can drive BP up. So there has been a correlation between people who don't get enough antioxidants, especially coming from fruit, and BP going up. But I mean, like, see, this I would take with a caveat, because just because I said low fruit consumption, then tomorrow everyone goes and buys mangoes and say, oh, I'm going to eat all mangoes in the day because I want to keep my BP down. That would be a slightly bigger problem to manage, because then your carb load will just go up throughout the day. So fruits, I would recommend, if you want to eat berries. Like now blueberries are easily available in India. So raspberries, blueberries, and eat really colorful fruits, right? Like papaya, pineapple. But check your blood sugar levels, check if you have insulin resistance, and then work with someone who knows about how to help you manage your sugar levels along with fruit consumption, because almost everyone in India is diabetic. Obesity and weight gain we spoke of. If you have diabetes, if you have high triglycerides, right? Like your triglycerides are above 100, that can lead to blood pressure going up. And if you're drinking a lot of alcohol, I spoke about it already, but alcohol can cause BP issues. So coming back again to what kind of diseases can happen with hypertension, heart failure we spoke of, myocardial infarction, which is basically a heart attack, coronary heart disease, cerebral hemorrhage, which is brain damage, preeclampsia, eclampsia, I spoke about this with regards to pregnancy, stroke, like how you'd have like a heart attack because of your artery getting clogged. There could be a possibility of a similar clot happening in the brain and you suffering from from stroke. Chronic kidney failure we spoke about, blindness, aortic aneurysm. So these are all very, very high possibilities if your hypertension doesn't get treated. Okay. It is a major cause of morbidity and mortality and needs to be treated. It is an extremely common condition. However, it is still underdiagnosed and undertreated. It is super easy to diagnose, right? All that you need is you get that BP monitor and you see if you have high BP or not. You don't even need complicated tests to see whether you have high BP or not. To find out the root cause of high BP, yes, you need blood tests. The typically in conventional medicine, they're just trying to manage high BP, right? So their aim of management is just to save the target organ from deleterious effect. And usually they just use like pharmaceutical drugs, right? But if we understand how big an impact lifestyle modification has, all of the pharmaceutical work around high blood pressure would just end. Okay. What is the non-pharmacological treatment of hypertension? Find the root cause, eat as per bio-individuality, fix your nutrient deficiencies, modify lifestyle, and meditate. These are really things that can treat hypertension without drugs. And each of these steps is vitally important in this process. How do we get to, because I spoke of the root cause many times, I spoke of how there could be different reasons for someone actually experiencing high BP. So how do you get to the root cause? You could start with basic blood tests. If you need advanced tests, like if you want to find out if genetics is causing it, or you want to see if you have too many infections and that is causing high BP, we can do that. You can also do an ECG to understand the heart's function. You can use, you can do an ultrasound of the heart and the kidneys to see how they're functioning. Is there too much pressure that's happening inside? It's pretty cool to see your heart ultrasound. Okay, if you've not done it, it's an interesting thing to do. And you could just buy a home blood pressure monitor, which you get at most chemists nowadays. Okay, so blood tests, these are some of the reports from our own patients who had the high BP. So as you can see, What is coming up here is this person has liver dysfunction. There are multiple deficiencies. We can see that there is stress. So this is a person who had high BP who came to us, and we ran his basic blood work, and this is everything that we found out, right? Like there was chronic infection, liver dysfunction here, anemia of iron deficiency. And then you can see that the infection and inflammation parameters are very, very high. Look at this ESR, we want it to be below 5. His ESR is 29. CRP should be under 0.5. This CRP is 6.3. Okay. Homocysteine should be 5 to 9. This person's homocysteine is 45.7. Now, homocysteine is an excellent marker of what is happening with your blood. Is your blood thickening? Is your blood moving smoothly? So this person has multiple deficiencies, infections, liver dysfunction, renal dysfunction, kidney dysfunction that's coming up in our analysis. And we can also see his liver is messed up, right? So what we saw in the earlier set, like the CBC was telling us liver dysfunction in 2-3 places. And then when we actually go to the liver parameters, we are seeing that the enzymes are way, way above our optimal ranges, right? Even the fatty liver index is very, very high. So it's no surprise that this person actually has presented with high BP. And the beauty of this is once we know that this is going on, right? Once we know that all of these parameters are off, we keep our focus on bringing them into normal. Once we do that, the BP levels optimize on their own. Look at this, even the kidney health is showing so many reds. Okay. If you remember, I spoke of advanced tests. These are some of the advanced tests. So for in this person's case, for example, if we found that there were a lot of infections, right? Like in the WBC panel, we see infections come up in multiple parameters. Then we want to go check with an advanced test if there are indeed infections, and then we find. So this is of course not the same person's report, but then you find that there are so many infections. Same thing with the GI map. We found that there were so many infections in the gut also. Sometimes if semen has a very high level of chemical toxicity, too many toxins in the bloodstream overburdens the liver, overburdens the kidneys, and that can then indirectly cause elevated BP. Okay. So what does conventional medicine do? What would happen if you went to a doctor with high BP? You would be given this ACE inhibitors, right? So Telma and all of these medicines, you would be given these ACE inhibitors that block the production of angiotensin 2 hormone, which the body actually naturally uses to manage blood pressure. So your body naturally has systems to manage, but this goes and blocks the hormone. And then you have the angiotensin 2 receptor blocker. So one is like it blocks the enzyme itself. Second, it goes and blocks the receptors. And third is that actually there are also these things called as calcium channel blockers. So these blockers prevent calcium from entering the muscle cells of your heart and blood vessels, allowing these vessels to relax. So calcium actually, when calcium enters your cells, it creates a contraction. So calcium channel blockers go in, I mean, they kind of prevent calcium from going into your heart. So your heart doesn't contract, it remains in a more state of relaxation. Are these a good idea? Not at all, because each of these medicines actually have a lot of side effects in the body. What is it we do? So we practice something called as functional medicine. And in functional medicine, we look for the root causes. Remember those steps I had shown? Find the root cause, create bio-individual diet plans. Yeah. So this is what we do, right? So we find the root cause and then we help people eat as per their bio-individuality. We fix nutrient deficiencies. We work on the completely holistic lifestyle modification, including adding meditation into their everyday life. And that method actually works in permanently reversing the disease more than giving the medicines, because what these medicines are doing is they're artificially keeping your BP low. As long as you're taking the medicine, your BP is low. The minute you stop taking the medicine, your BP is going to shoot up. So you're doing this to artificially suppress, plus you're going to have a lot of side effects of those medications. So this is something that we don't ever recommend. We prefer doing this in a more holistic, research-based way. Okay, but from today's webinar, if you want to really, I would urge you to make notes from this slide. If you're someone who is suffering from high BP, or if you have someone in the family who's suffering from high BP, I mean, this is a generic plan, right? I would still prefer looking at your blood test and then coming to a total understanding. But step one, eliminate all inflammatory foods. So eliminating inflammatory foods means removing things like gluten and dairy and sugar, soya bean. Then you eliminate seed oil. So all the oils that come from vegetables. So sesame oil, mustard seed oil, groundnut oil, sunflower oil. You eliminate all of these oils. You reduce processed foods. So processed foods trigger inflammation. So what are processed foods? They're basically foods that come out of boxes and packets. So you don't want too many of these, so you eliminate these. And then supplements help, but with supplements, I would prefer doing blood tests and then seeing which ones do you really need. You can do probiotics. They help with maintaining BP. Vitamin D supplementation also helps with maintaining BP and like really making sure it's get regulated. Garlic helps. Okay, studies have shown consumption of garlic at this dosage for about 12 weeks helps in bringing BP down. And do nutritional management through food, right? So high protein food, good quality fat, avoid too many of these heavy grains, eat more of the vegetables like carrots and sweet potatoes, which are good for your gut. Lifestyle modification, this is a big thing when it comes to BP. So exercise, very, very important. Quit smoking, guys. If you have BP and you're still smoking, I would recommend completely stopping smoking. Stress management, reducing toxins, and environmental factors also now work on that, like because a lot of environmental toxins can trigger inflammation and then make BP high. So particulate matter, for example, the exhaust fumes that are there on the road, they can cause dysfunction in your blood vessels, vascular dysfunction, and then can lead to increased blood pressure. So this is what I wanted to cover. We are doing very well in terms of time. I am going to go check the Zoom chat and see if there are any questions there. So far, there are no questions. But if you have any questions, please ask. And yeah, I'm here to answer your questions. Can iron deficiency cause high BP? Well, it depends on what is causing that iron deficiency. If it's infections that are triggering the iron deficiency, then yes, for sure, BP can go up. I hope that answers your question. So always find the root cause. Even for iron deficiency, there are many root causes. Insulin resistance, for sure. I covered that also in the earlier parts of the slide. Insulin resistance definitely triggers high BP. So what is the difference between basic and advanced blood tests? Basic tests are what you can do here in India, right? Like your CBC, liver function, kidney function, that entire whole body panel. Advanced tests are very specific tests. So for example, if you want to test for genetics, then we send the sample to the US where your entire gene map is done. If you want to test for your gut dysfunction, how well is your gut functioning? Is there a dysbiosis? Is it functioning well or not? Then that is a stool test. Again, that is sent to the US. Then we have another test called as the organic acid test. That's more to check your metabolic pathways only. Is your biochemistry working well, right? Your fat, carb, protein digestion, your neurotransmitter production, how is that going? And then we also do tests on autoimmune panels. So those also tell us if you have any autoimmune conditions that is caused by pathogens. Please suggest oils to be included apart from olive oil. So Shruti, I would recommend ghee, butter, coconut oil in this priority, or butter, ghee and coconut oil. These are the three best cooking mediums, even better than olive oil. Does weightlifting cause high blood pressure permanently? Shouldn't. Okay, so when you lift weights, you are actually stressing your body out, and to help your body with that output, right, like of pushing the weight and all, your BP is going to go up, but that's like normal, and it's not going to be so high that you're going to have high BP symptoms. But weight training is not really going to cause permanent blood pressure increase. Okay, so if you're seeing high blood pressure, there is got to be some other reason and not weightlifting. Weightlifting might trigger momentary increase in blood pressure. How to manage drug dosage? So Madhvi, see, I mean, I'm not legally authorized to recommend drug dosage and talk about drugs, but what I would do if somebody was already on a combination of drugs, I would investigate the root cause, make changes to the lifestyle and the food and all of that, see if the BP actually is naturally tapering down. And then whichever doctor has prescribed those medications, then bring that doctor into confidence and say that, like, look, my BP is okay. So can we just look at tapering off some of the medications? Does krill oil help? Yes, Shamsuddin, krill oil does help because krill oil is rich in omega-3 fatty acids and astaxanthin. Both of these things actually reduce inflammation. Because it reduces inflammation, your BP can actually come down. If there are any other disorders associated like pre-diabetes, PCOD, well, this basic blood work is enough, right? Because see, the body is one unit. So even if you have, and it is actually, we've seen this with almost every case. When someone comes to us with one condition, they'll also have some other condition happening in the body. So even if you have 2-3 diagnoses already, like someone has got diabetes and PCOD and high BP diagnosis, you still need the basic blood work to understand what is at the root, right? What is triggering this issue? So these basic blood tests are important. Does hormonal imbalance cause high BP? Yes, Anita, I actually spoke about it. I spoke of how cortisol, adrenaline, even sometimes progesterone and like the testosterone also, right? Like all of these hormones are part of a very tightly knit regulatory process when it comes to your blood pressure. So if that is imbalanced, it can immediately trigger high BP. So yes, that can happen too.
Mukta, can I ask a question? Mukta, I want to ask a question.
Yoga helps. So this is yoga is part of the lifestyle modification, right? So when we say exercise or movement, in fact, yoga is an excellent way to reduce BP because what yoga does is it also stimulates the vagus nerve. So the vagus nerve is a nerve that has branches right like from the top of your, like the base of your skull, right at the back of your head to all your organs, right up to your liver, pancreas, and even your digestive system. So when you do yoga in a gentle way, what yoga can do is it can stimulate the vagus nerve to kind of tell your body that it can create a parasympathetic response, which is the rest and digest and relaxation response. So if you're using movement actively to create that relaxation response, whatever could be the trigger for your high BP, that's going to get a feedback saying maybe I can bring my BP down, and yoga does a phenomenal job in bringing BP down. Recommended salt intake, but yeah, while I said that, yoga will not solve the root cause. So yoga will help bring BP down as long as you're doing yoga. But if the root cause is not fixed, then your BP can go up again. Recommended salt intake to avoid high BP. I don't really have like a recommended salt intake. We all have our individual salt tolerance. What we have seen in our work now is we have rarely limited salt to somebody who has high BP issues. We have never reduced anyone's salt intake. Like not one patient's salt intake have we reduced. We have worked on the other things, the insulin resistance, the infection, the inflammation, and they have tolerated salt. Like there has been no problem at all with salt and BP going up. So there is no need to do salt substitutes. Like salt is an essential nutrient. Please do not be afraid of it if you have high BP. There's some other reason why BP is going up, not the salt. Any other questions?
Mukta, I have a question. I want to know if someone's blood pressure is 80/60. So according to functional medicine, do you consider it as low blood pressure? Is there something called low blood pressure? Because the conventional
is
doctors
pink salt better? I actually switched to pink salt many years ago because I did not want to use iodized salt for sure. But recently I found out that even pink salt, when it is made, they use a lot of blasting. Like pink salt usually comes from the quarries, northern Punjab, Pakistan, that's where it comes from. And they use a lot of blasting, like, dynamite blasting to kind of get salt from the quarries and then powder it. So there's a high chance that pink salt might have a lot of residues, right, of these dynamite blasts. So I switched to desert salt recently, like salt that is just coming from Rajasthan, and that is much better. So white desert salt, or you can use sea salt, but not iodized Tata Namak, just clean sea salt. That is also much better than the pink salt. Which brand am I using? I can't remember. Maybe I'll send it like once I go home. I'll send a picture of the brand I'm using on the group. Cannot remember the name, but you get now a lot of brands for sea salt also that are just clean non-iodized sea salt. That's it. So my recommendation is, if any of you have joined this webinar because you're suffering from hypertension, or someone you know has high BP, get blood work done, find out what is at the root of it. No, non-veg does not cause high BP. If non-veg had caused high BP, I should have had the highest blood pressure of anyone in this call, but I don't. So eating non-veg does not cause high BP. If someone's BP is 80/60, do you consider it as low BP? Yes, it is low BP. Now, see, if this BP was measured after like a breathwork session, after yoga practice, it is possible that this could be low. But if somebody is having this kind of low BP consistently, that could be an adrenal issue. We are not discussing low BP in today's webinar, but if someone is having this low BP consistently, it could mean that the adrenals are fatigued and like the cortisol cycle is completely gotten messed up. Not when it comes to like helping bring down. So Madhvi's question is, do we consider resting heart rate, right? So it's always good to have a low resting heart rate. Like the lower it is, the better. Unlike BP, like low BP is a sign of low cortisol production. Low resting heart rate actually is much better for your heart because it's working less hard to maintain your bodily functions, which means you're going to get a longer life from that heart. So lower resting heart rate is good. Athletes actually have lower resting heart rates even up to like 50 and all of that. Avinash, who takes care of operations, he's an ultra marathoner. So sometimes when he's like training really well, his resting heart rate goes into 50s. Okay, and it's like he's absolutely okay because he's trained his heart to be that. That's great, Madhvi. If it's at 50, it's a really great resting heart rate. Low BP, is it reversible? Yes, if we find the root cause, for sure. Okay, because what I've seen is low BP often is tied to the entire cortisol imbalance. Is sweating, hair loss, and anxiety associated with hypertension? Hair loss, not so much. Sweating, yes. And because see, sweating also is part of that entire fight or flight response. So anxiety, sweating, yes. What tests are required? So the tests remain standard, okay, because the tests are looking for root causes. Finding out what is the reason for low BP, that is important. So the tests don't change. I have nephrotic syndrome, proteinuria, taking Telma 40. So in your case, Vandana, see, nephrotic syndrome is already like a really complicated kidney condition. We can improve the kidney's function a little bit, but in this case, completely stopping medication, like I don't want to say it is going to happen. If you're not doing any major exercise and training, then your heart rate is 59. I think that is okay. Low resting heart rates are good, but you also have to train your body, okay? So you have to give that challenge to your heart also. All right, so it's 8:50. I think we had quite an interesting Q&A session also. Thank you so much, all of you, for joining in. And yeah, let's close it for today. Great Friday, you guys. Tomorrow we are really busy. We have a book launch. I'm going to show you. I have a copy of the book right here. So this is our book, the first book that I wrote that we're launching tomorrow. We will send links to purchase this book once the official launch is over. So that's our big day for tomorrow. Thank you so much for being here on a Friday evening. Wish you all a very, very great weekend.
Hey Mugdha,
Okay.
before we close, will you guys be sharing
Thank you,
the
ma'am.
recording with us? Hi Mugdha, are you
Right,
there?
so I'm ending the session.
I
And
think
in case any of you want to
think
reach out
she's
to
not
us,
able to
Ronak has
hear.
already put out the
Oh,
links. He'll
okay.
also send it on the group. And all the best, you guys.